Good morning, everyone. We'll call the meeting to order of the Youth Health and Human Services Committee of October 20th to order. Roll call, please.
Chair Tornatori.
Here.
Member Desart.
Here.
Okay. Member DeCiani.
Here.
Member Eckhoff.
Here.
Member Larson. Member Renahan.
Here.
We have a quorum. We do not have a physical quorum in the building, so we will do all of our motions by roll call. I have no report this morning.
Good morning, everyone.
And Member Larson has just woke everybody up. That's good. That's good. I'll entertain a motion to approve the minutes of October 6, 2020.
So moved.
The motion, is there a second?
Second.
The motion and a second. Any additions, corrections, or deletions? Hearing none, seeing none, roll call, please.
Member Larson.
Aye.
Member Renahan.
Aye.
Member Desart.
Aye.
Member DeCiani.
Aye.
Member Eckhoff.
Aye.
Chair Tornatori.
Aye, and the minutes are approved. Moving on to community services, I'll entertain a motion to combine and approve items 6A, B, C, and D. These are acceptance and appropriations and an amendment resolution. The motion and second. Any questions, comments? Roll call, please.
Member Eckhoff.
Aye.
Member Larson.
Aye.
Member Renahan.
Aye.
Member Desart.
Aye.
Member DeCiani.
Aye.
Chair Tornatori.
Aye. And the motion carries. Moving on to item 7, community development. I'll entertain a motion to combine and approve items 7A through J. These are all recommendations for approval of modifications
So moved.
to
Second.
various contracts for
Desart.
the motion and a second.
Mr. Chairman, I do have one. I apologize, I did not mention this to you before the meeting. On item C, the approval for Midwest Shelter for Homeless Veterans, there's a small error on the resolution itself. On the 8th paragraph where it says, be it further resolved that the chairman of the county board is authorized and directed to execute the modification. It should say directed to execute the agreement. It was cut and pasted from another resolution. So can we make that modification to the resolution?
Okay, certainly. We've got a motion to combine and approve all of those as to item C. Is there any objection to correcting Scrivener's error as was in the resolution? Hearing none, seeing none, I think that's an easy fix.
State's attorney says, okay.
Yeah, it's a motion to modify, so it just has to be seconded and approved.
All right, I will move to correct the Scrivener's error with respect to 7C as articulated by Stephen.
Okay, so we have a motion and a second to amend item 7C. Any discussion on that item? Hearing none, seeing none, roll call, please.
Member Larson.
Aye.
Member Renahan.
Aye.
Member Desart.
Aye.
Member DeCiani.
Aye.
Member Eckhoff.
Aye.
And Chair Tornatori.
Aye. That has been approved. Going back to the original motion to combine and approve items 7A through J. Any discussion further? Hearing none, seeing none, roll call, please.
Member DeCiani.
Aye.
Member Eckhoff.
Aye.
Member Larson.
Aye.
Member Renahan.
Aye.
Member Desart.
Aye.
And Chair Tornatori.
Aye. And the motion carries. Moving on to DuPage Care Center, I'll entertain a motion to approve item 8A1 HHSR 582-20 is a resolution to
So moved, Desart.
increase the per patient base charge. There's a motion by member Desart, seconded by member DeCiani. Any questions, discussion? Hearing none, seeing none, roll call, please.
Member Desart.
Aye.
Member DeCiani.
Aye.
Member Eckhoff.
Aye.
Member Larson.
Aye.
Member Renahan.
Aye.
Chair Tornatori.
Aye. Motion carries. I'll entertain a motion to approve HHSP 276-20, a recommendation for purchase order to Easy Way Inc. for smart stands and lifts.
So moved. Second.
The motion and a second. Any discussion, questions, comments? Roll call, please.
Member Larson.
Aye.
Member Renahan.
Aye.
Member Desart,
Aye.
Member DeCiani.
Aye.
Member Eckhoff,
Aye.
Chair Tornatori.
Aye, and the motion carries. Moving on to DuPage Care Center request for final approval. I'll entertain a motion to approve a change order to First Biomedical DBA Infuse Systems, Inc. for rental of infusion pumps
So moved.
for a period from 8/1/20 through 7/31/20 to amend the contract to the amount of $12,000.
So moved.
Second.
A motion and a second. Any discussion, questions? Roll call, please.
Member Eckhoff,
Aye.
Member Larson,
Aye.
Member Renahan,
Aye.
Member Desart,
Aye.
Member DeCiani,
Aye.
Chair Tornatori.
Aye, the motion carries. I'll entertain a motion to approve 2020-250, recommendation for approval of a contract to DuPage Radon Contractors.
So moved to Sarge.
Second.
Motion by member Desart, second by member Larson. Any questions, comments, discussion? Roll call, please.
Member Desart,
Aye.
Member DeCiani.
Aye.
Member Eckhoff,
Aye.
Member Larson,
Aye.
Member Renahan,
Aye.
Chair Tornatori.
And the motion carries. Moving on to budget transfers, I'll entertain a motion to approve budget transfer from DuPage Care Center to transfer monies to cover a tilt truck equipment for housekeeping, maintenance services, and automated dispensing machine.
So moved.
Second.
Motion by member Larson, second
Second.
by member Eckhoff. Any discussion, questions? Roll call, please.
Okay. Member Larson.
Aye.
Member Renahan.
Aye.
Member Desart,
Aye.
Member DeCiani.
Aye.
Member Eckhoff,
Aye.
Chair Tornatori.
Aye, and the motion carries. We got residency waivers. Do we have any residency waivers, Janelle?
No, we do not.
Okay, moving on to community services, Mary Keating.
Just a couple of things briefly. Our ombudsman staff have returned to doing actual in-person visits at the long-term care facilities in the county. That's at the direction of the state. The state was concerned that there were, kind of no third-party observers going into long-term care facilities. So when a resident reaches out to the ombudsman, the staff are doing in-person visits in the facilities. They're going through all the screening. We've provided them with PPE kits. They go through whatever screening protocol the long-term care facility is requiring, and so they can go into the buildings. Our adult protective services staff are also back working in the field, as are the weatherization staff. I had sent the committee a memo about a week ago, maybe 10 days ago, about just kind of an update on the $7 million in coronavirus relief funds. The funds for the rental assistance program will be on finance and county board agenda next week. We're working out the final details of the program with the agencies that we'll be working with. So we're hoping that that'll get rolled out the first week of November.
Thank you. Thank you, Mary. It's good to see you. Back to, I won't say normal, but it's good that we're getting back into the care centers, or into the long-term care centers. Care center update, Janelle, see you on.
Sure. Yep. So we are at 39 staff, 34 residents. Minimal increase in numbers there. We currently have 3 units on isolation, just related to potential exposures. So that's up. We're still testing all our staff and our residents weekly. We are still able to do outdoor visits. They are not dictated by an increase in the county positivity rate, which we're at 8.5 based on the data provided by IDPH. However, indoor visits would be. So if we get to 2 weeks without any cases and we start to look at the potential to do indoor visits, we would also be have to use the positivity rate to determine if indeed we're able to do that or not. Staffing continues to be a challenge at times with no CNA schools going on. Obviously, we're not adding any additions to the workforce, so that makes the whole industry a little more tight for staffing in an already challenged environment. So we're working with our agencies to come up with holiday plans now versus waiting. So there may be, like prior years, we worked with Jim McGuire and our agencies, and then presented some holiday rates related to that. So we're trying to get ahead of the game and solidify those arrangements now. And we've also been able to slowly add back volunteers, which has been great. You know, this facility really runs on a lot of volunteer assistance. And so we're very happy to see that they're able to start coming back in and willing to come back in. So that's been great. The outdoor visits, the resident dining room dining, and the patio time for rec therapy, the outdoor time, all takes an immense amount of labor just for transporting throughout the building and all of the structure process. So those volunteers are key in that. So we're very, very pleased. A little concerned with the uptick in numbers all throughout. We're seeing some uptick in facilities throughout Illinois. I'm hearing about an uptick there. So we're just going to remain diligent and keep pushing. That's it. Thank you.
Janelle, do you have a number for positivity, a percentage that would begin to have us looking at the indoor visits?
If we can do indoor visits after 2 weeks, the CMS guidelines is when we exceed 10%, we would need to discontinue our indoor visits and only do compassionate care visits, which has a whole nother set of criteria. It's usually end of life, very specific criteria.
But I thought you said right now we're only doing outdoor visits.
We
correct?
are only doing outdoor because we have to get to phase 2, which means we have to go 14 days without a positive resident case. And we get to about that 14th day and we have one person go positive. That's been the case for about 6 weeks now, 8 weeks.
Got it. Okay, thank you.
Mm-hmm.
Member DeSart's hand up.
Thank you. Janelle, thank you for everything that you do. You've done an incredible job. When you say that 39 staff and 34 residents have tested positive for COVID, where is that on the numbers that we've seen since, say, March? Like, what
That's the total. That's the total
for the
since
whole
April.
time.
Yes,
Okay,
very
more clear.
Very minimal numbers, yes.
Very, very good. Okay, my next question is, now that the weather's gotten a little colder, have you started using those pods or tents that you talked about last?
We are, they came up with a heating apparatus, so it would be electric heat, so I don't want to use any type of gas because I don't know if that filled up, you know, what would that do with the CO2 or carbon monoxide potential. So we are not using those. We came up with an electric, but it's got to be approved by the fire department. So today in the circle drive, we have the tower heaters out. So there's 4 tower heaters. This is the first time we're trying it on the circle drive. The families will be able to just come up there. It's already under the portico. So we have cover from the elements and then the heating, much like a restaurant, outdoor restaurant dining might have right now. So we're doing that today. So hopefully that will be warm enough at this point in time. We can't enclose that portico because that's not sprinklered. The sprinkler goes a little bit and then that big portico is detached, because if we didn't detach it, we would have had to years back piped sprinkler heads in there. So because they did it detached, that's not a requirement, but therefore now we can't enclose it because it's not sprinklered. So we're working within the means. We have a lot of options. So very creative group will make it work.
Good, thank you. I was wondering also, I was reading about a long-term care center in Joliet that lost 26 people due to COVID, staff and residents. And one of the families suing, saying that they're blaming the fact that there wasn't enough PPE. How is the care center doing with PPE?
We are great with PPE. We have no problem when I need something. I work with procurement, Jim McGuire or Sean Reese. You know, we're working with other departments. Animal control has been great. But we're in a great shape for that. In addition, you know, we've been going through all the sample supplies that Jim McGuire sent over to do that 3-year. So I get probably 4 to 8 samples of any different product. We look at it and pick our preference. And so that's the one that they will try and do under the large bulk PPE procurement bid.
Okay, and one more question and then I'll let you go. And that is, I'm so glad to see the volunteers are back in there, but how are we integrating them? Are we taking
We treat them like an employee. So they have to come in and they have to go through our testing, our screening. Yep.
Thank you.
You bet.
Sorry, we're doing a little wasp one.
Doing some exterminating here.
Jim just killed the wasp.
With the Sierra Club.
I yield my time, Chairman.
I'm sorry. Go ahead.
Sorry,
We got the wasp done.
Sorry,
So
Don.
you can go ahead if you want.
It's okay.
You're all good?
I'm all good. Yeah.
Okay. Any other questions of Janelle? Thank you, Janelle. Thank you for all you
Thank
do.
you. Thank you.
Any old business?
Mr. Chairman,
Yes.
I had a question just,
Chairman
thank you, Mr. Chairman. I had a question just for Mary in terms of food insecurity. I know we had a pretty, good size allocation to begin with, but we keep hearing how people are struggling. And I'm just wondering, do you feel that what we've allocated is sufficient or should we increase?
I think I can double check back with the food pantries that we have provided funding to. I think they were comfortable with the level that we did receive. Just as a reminder, we gave 3 food pantries, 125,000 each. Those were the 3 largest pantries that will serve anyone in the county. And then we gave 625,000 to the Northern Illinois Food Bank. That's going to be used not only for commodities, but also to help smaller food pantries with equipment needs. They need additional refrigeration or freezer capacity. The food bank was extremely thankful for the generous contribution. I think the biggest challenge is that these funds have to be expended by the end of the year. So the food pantries are concerned about the first quarter of 2021, but the CRF funds, unless Congress extends the deadline for spending, the food pantries, I think are a bit concerned about not just their ability to spend it by the end of the year, but that sort of drop off that, what happens now because even if they purchase the food in December, they can use it in January, but, beyond that, they're concerned. But I'm comfortable with what we've provided. The 625 that the Northern Illinois Food Bank is getting will be available to any food pantry in the county that accesses, that's a partner with Northern Illinois Food Bank. That's over 50 different food pantries and feeding sites. So I can check back with those organizations. Please, if you're hearing from other food pantries that it's not enough, let me know. And we'll see if there's additional resources we can identify.
We've also allocated money to the food pantries at the townships too, haven't we?
Separately, yes.
So that's separate. Okay.
Yeah.
Yeah, thank you. I just know, I've seen food lines around the blocks in Hinsdale. Right? We're seeing just unprecedented need, and I just want to make sure that we're stepping up. And I know we are. I just want to make sure it's enough. Thanks, Mary.
Thank you. Any other questions of Mary or anyone? Anything under old business? Any new business? Hearing none? Yes, member say, Vice Chairman says here.
No, I just, Sam, I talked to you yesterday. I'm just concerned about the health department. You and Bob are here, and I just don't understand the matrix that we're using for schools. Again, yesterday they're talking about a 46% increase. I need numbers. I took percentages scare people. That sounds like a big number. I'm looking through the charts here, and I'm not a NASA scientist to take a look at all this, but it looks like, the positivity rate for kids, from 0 to 19 is about, I think, 24 to 26 a week. The thing that bothered me yesterday that we didn't know about it, which I understand, but if you listen to the whole interview and stuff, it says they're telling people to go back to remote learning, which hybrid had just started this week in DuPage County. Literally, it just started in many districts.
Let me stop you. Nobody's telling schools to go back to hybrid learning. There's a recommendation based on the metrics from IDPH and a variety of sources. It's ultimately the superintendents and the school boards who make that decision.
Right. Who set up the matrix?
It's IDPH.
The county health department didn't have anything to do.
Oh, yeah.
Okay.
It's something to do with it, but
If you go through the whole article, it says the thing that bothers me, and I'm telling you, you're hearing frustration from parents. I'm a parent. I'm frustrated. I think I know what's going on. I don't. It's that they're saying that the increase is not coming from the schools. So why would the first thing you would do would be to then shut the schools down and go back to remote learning if the increase is not coming from schools? That's what I didn't understand where we're going on this. And again, if we could get solid numbers of what the cases are, I'm looking at if it's 25 cases, again, there's a big increase 15 to 19. Is that because we have 3 colleges here that are testing? North Central, Wheaton, Elmhurst University are all testing weekly, bi-weekly, whatever they're doing. Are those numbers being thrown into there that are affecting our high schools? I just would like to get some more information from the health department because it is alarming and it's alarming to parents. And again, I mean,
It is.
the last time we saw this spike was right when the kids were going to go back in August. There's a lot of conspiracy people going out there going, come on, how could this happen? The last time in August when we were supposed to go back to school, there was a spike. And now we're going back to hybrid learning and there's a spike.
Well, I
think we
can
just need
assure
more
you
numbers.
that, I can assure you that myself, Karen, anybody involved with the health department is not involved in any conspiracy theories for no other reason than we're tired of people talking about conspiracy theories. But the reality is that, and I'm not a public health professional, but I think to answer your question, why would we shut down a school if the positivity is coming from somewhere else? Is that if that school kid gets it from mom, dad, or whoever else and brings it into a school that's got 3,000 kids, now you've got that exponential problem that exists. So I don't think it has to emanate from the schools per se. It doesn't really matter where it starts. It's ultimately where it finishes. But I will have Karen, I'll talk to her this afternoon. I know there's a call with the governor's office and IDPH and our people this afternoon to talk about a variety of things, including schools. But I will have Karen send the members of the committee as well as the members of the board, the county board, kind of an update and maybe answering some questions regarding schools. But I just want to be clear. The health department has never told the schools to do anything. They made recommendations based on the metrics, and the school superintendents are taking their marching orders from their boards, who ultimately are following what their parents want to do. That's why you're seeing a number of different districts have a number of different ways to go about their learning, whether it's in-person, hybrid, or virtual. So all we're doing is giving the numbers out, and ultimately the schools are making those decisions. Member Larson.
So just to follow up on that, and I'm kind of in the middle between those two things. Although I don't have kids in the school system, I understand that, the last thing we want is a rebound of COVID-19, but we also all know that there are real world impacts to health, to finances and everything for people when kids get pulled out of school, parents can't work. Kids are at home in an environment that may or may not be conducive to learning. They lose the ability to socialize and those sorts of things. So we're always trying to strike that balance, and it can be a difficult balance to strike. My concern, and I've seen this through 30 years of being a lawyer, is school boards and school superintendents, yeah, they're looking at the information, but if the information isn't clear, and this is what I've gotten in terms of feedback from some of my constituents, is the schools are defaulting to what for them is the legally safest option. Hey, if somebody says there's any potential issue out there, shut it down. That way nobody can accuse me of a problem if somebody gets COVID. Not weighing the other side of that balance, which is that there are other real world things. It's easier for them to find a justification in a really complex set of guidelines or recommendations to say, well, they said this would be a good idea. I'm not going to be the guy that answers for it if a problem arises, so we're just going to shut it down. And I know that's not something the Board of Health can control. I know from interacting with my constituents, the Board of Health has been trying to get more clarity from the IDPH, and they put out these very vague guidelines that cause these schools and their attorneys and their boards to be overly defensive in the way they react and the way they interact with their parents and their students. And that's an ongoing problem. So greater clarity, we hope we'll continue to work with the IDPH to get greater clarity to figure out ways to do this rather than always defaulting to, well, I'm just not going to take that chance.
And I agree with you, as a lawyer, the default provision would be, sure, nobody wants to take that potential responsibility, but again, that falls on the school superintendents and the school districts. You can't blame the health department for whatever the recommendations are if the school superintendents decide to go in this default position. The flip side of it is, if I were the lawyer for the health department, I'd be very careful on what the recommendations would be as well, so that the opposite doesn't happen and you've got kids in school and there's an outbreak. So from my understanding, the health department is working on numbers, metrics. They're getting from a variety of sources, IDPH, CDC, locally, all putting it together making a recommendation based on those metrics, and ultimately it's the school superintendents and those districts should make that decision. And, you know, and nothing's forever. When I was telling somebody last night, who was in a panic that we're going to shut down the restaurants. There's no discussion of shutting down the restaurants. There may be some discussion regarding reducing the number of people in restaurants for the time being. We saw that in Will County a few weeks back, but that passed. So I think it's a matter of bringing things back into where we were. The bottom line is, if you look at the dashboard from the health department, you're going to see for a variety of different things that the trend is moving in the wrong direction. We have more people now than we had last week, and those are more people testing positive than the week before. So as long as that trend is going in the wrong direction, I've had this discussion numerous times with Karen and the other professionals, the trend is what they look at. And when the trend is moving in the wrong direction, they start to get worried. I'm Rebecca. Okay, thanks. Good luck with that.
I guess I'll just jump in and say the same thing I discussed with you a little while ago, is that all these other factors that Mr. Larson discussed, they're not in the report. And it seems to me on the first page where it says the DuPage County Health Department encourages 100% remote learning, that at least they should have a discussion about the other health related issues, such as kids going without meals, physical abuse not being detected, how effective remote learning is. I mean, you hear stories all the time about how parents don't think it's good, how parents can't go to work. So all those other factors seem to me should have been considered and put out, because people read this report and it seems like all we do is look at the substantial level. But another issue that I didn't see.
That's their job, though. I mean, the job of the health department is to look at those numbers and make those recommendations based on the metrics. If you want a 4,000-page document talking about, you know, what may or may not happen because kids aren't going to school and how it's affecting them socially, you can get that, but I'm not so sure that that's the health department's.
Well, to me, it's
job.
it's health.
I'll give it.
Abuse is health.
Certainly, it's health.
And they could have just put bullet points. The schools board should also consider boom, 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 boom. But the other thing is, I'm trying to figure out what the goal is here. Is the goal that we have before we can send kids back to normal classroom, it's 0 transmissions? Is it below, like you said, the dashboard level has to be so low? It just, anytime anything spikes, I don't know who's spiking. I don't know if it's school kids or 50-year-olds or 80-year-olds, but we pull the plug and quarantine the entire population as opposed to the people who are getting sick.
Well, the entire population is not being quarantined, so let's not, you know, let's be clear. And again, I'm happy to be cross-examined, but the reality here is that what we're talking about is when there's a spike, and if you look at the dashboard, you'll see that the substantial number of people who are testing positive are people from the ages of 10 to 19. The most people who are dying are the older people, but the people who are testing positive are younger people. And if you drive by any park or any gathering, you're going to see hundreds of kids playing baseball, football, basketball, wherever outside in gatherings, and that's where it's coming from. And they take that home, mom, dad, grandma, grandpa, particularly in many of the communities where we have multiple families living in the same household.
Then we get reports from the health department that 99.4% of these people show little or no symptoms. And so the people who are, and the people who show the fewest symptoms are the kids. And so, yeah, they may be spiking, but it doesn't affect them. They either, you know, get the common.
Yeah, they don't show the symptoms, but they bring it home to their 75-year-old grandmother who's home, who ultimately is the most vulnerable because of their age. You know, again, you can cherry pick whatever you want, Grant. The reality is that it is what it is.
Yeah,
you are.
That's what I use.
All right, I know.
That's my phrase.
I'll
I'm going to reserve the Kool-Aid comment to myself.
Chairman, can I add a comment real quick? Chairman? Thank you, Chairman. You know, you mentioned about it's the superintendent's decision. When they're given.
Lost you.
No, you lost.
Lost you.
But Sam, here's the thing. Those kids have been in those parks all summer.
I know.
But before it was 4th of July caused it. It was Labor Day to cause it.
Given
Now
a
it's the
direct
parks
negatives of, yeah.
Pete,
So-
we're
so-
losing you. We lost you.
Lost me? Sorry, hold on one second. Bear with me. Let me see if I can get a better connection. 1 second here. How's that better? Give me a
Yeah,
second.
go ahead.
Okay. Anyway, the concern for the first, school district to be back in, and they put the special ed kids in, one of which is my daughter. It's hard to get services when you have an IEP from home. Speech therapy, occupational therapy, these are all things where you have to be in school to get those services. So, it's important that we're in school and have these resources for our kids, especially kids with IEPs. And, if community spread is going to be the issue, then let's deal with it at a community level. But to basically take it out on our schools when the CDC says they should be in, and schools are not causing the issue. All of our Catholic schools and private schools are in school, and we have not had one outbreak. IC's in, Viz is in. In fact, a lot of my siblings took their kids out of public schools and put them in the private so they could have an in-school, opportunity. So, to say that the superintendents make this decision, I think, is a fallacy when the county.
Remember, DeCiani, there's a lot of misinformation going on here this morning, and we can talk about this. There's other meetings, people had to go to transportation.
I get it.
You guys can direct your questions to Karen. The reality is the school superintendents are making the decisions through their school boards. The Department of Public Health in DuPage County is not. Now, whether or not kids can be in schools or not has become an individual decision by the school boards and those school superintendents. And the reality is that when they get heat from the parents, they like to blame the most logical person to blame, and that's the health department. And the health department told us to do this. And I don't blame them.
Mhm.
But the reality is recommendations are made through IDPH, through CDC, any number of things. And trust me, the health department is not looking to close schools. And if the Catholic schools, and I'm well aware of the fact that the Catholic schools, some are open, not all. But that's a whole different ballgame. So it's not a fallacy. I can't let you get away with saying that that's a fallacy. It is a fact.
When they're given a directive, it's hard to say no.
Not a directive. It's not a directive. I don't mean to be nitpicky, but that's what I do for a living. It's not a directive. It's a recommendation. So, it is what it is. I'm going to tell Karen, we had this discussion. I'll have her send you all information. Please contact her. She usually will get back to you when she can find a minute. She may be a little slower because she broke her right wrist the other week and had surgery. So I don't know how quickly she's back at the computer, but the reality is she could certainly better answer these questions than I. Any other discussion under new business? Hearing none, seeing none, without objection, we're adjourned. Thank you. And I think we still have a quorum. Yes, we do.
Yes.
Okay. Good.